All right, so 1 in every 8 women will develop breast cancer in her lifetime. Think about it, 1 in every 8. That's about 287,000 new cases expected this year, which amounts to a diagnosis every 2 minutes. The earlier you're diagnosed, the better your chances, obviously. And as we recognize Breast Cancer Awareness Month, Dr. Scott Ackerman with Ackerman Cancer Center is joining us with some important reminders. Good morning. Thanks for being with us.
Thank you, Jen.
Appreciate it. So detection really can start at home, particularly with breast self-exams. Can you explain why there are so many misconceptions about these exams?
Well, a lot of women are nervous about breast self-examination because they find things, they get confused by those things, and so a lot of women just don't want to do it. But the truth is that most breast cancers, believe it or not, are diagnosed by women themselves through breast self-examination. We talk about mammograms and all that all the time and physician examinations, but at the end of the day, breast self-examination still makes a woman alert to something abnormal and prompts her to go see her physician and get the mammogram that she might need to get and those sort of things. So we recommend breast self-examination beginning at age 20, or even younger you could, there's no harm in it, to be done every month, the same time of the month, preferably mid-cycle. And there's ways to do it. A woman can go online and see different ways to go through the breast, but you want to do a thorough examination of your breasts. And the reason to do it every month is so that you know what your breasts are normally like. Because everyone has a lump somewhere. I mean, if I feel my thigh, I might feel a lump. So those lumps that you feel, you know about, and when you examine your breasts from month to month, you'll see stability in those, and any changes would alert you that something might be wrong.
So another part of early detection, obviously, is mammograms. And you and I have talked about this a lot over the years because they really can mean the difference between life and death. Would you explain what age someone should be when they should start getting a mammogram? Because family history becomes a component in this as well.
So there's been different societies have slightly different recommendations regarding mammography. There's the American Society of Breast Imagers, the American Cancer Society, the U.S. Preventive Services Task Force. They have slightly different recommendations. What I tell women is that they should get have a mammogram done every year beginning at age 40. So annually after the age 40. There are some recommendations to do it every 2 years. I still recommend annually after age 40. If you're at high risk, you can consider getting a mammogram earlier, but your first one may be at age 35 to get a baseline. So high risk would mean that you have a family history of breast cancer, a mother or an aunt with breast cancer, and those women I recommend getting a baseline at age 35. If that's a little funny, then you would get some more frequently after that, but if that's okay, then start annually at the age of 40.
So we learned something. I want to pivot, if I could, from breast cancer for a moment, because we learned while we were on the air, in fact, here this morning, that a local activist, Ben Frazier, a very well-known figure in our community, announced on Facebook that he has cancer, specifically non-Hodgkin's lymphoma. Can you tell us a little bit about this disease and how it's treated?
So there's lymphomas, and so there's Hodgkin's disease, which is a type of lymphoma, and non-Hodgkin's lymphomas. So non-Hodgkin's lymphoma we heard about recently in the news a couple of months ago. Jane Fonda announced that she was diagnosed with non-Hodgkin's lymphoma. It typically affects people a little bit older than Hodgkin's disease, and non-Hodgkin's lymphoma is a disease of the lymph nodes. It begins in the lymph nodes generally, and it's a abnormal growth of cells within lymph nodes.
And so how is it treated? Typically like other cancers then?
Yes, well, many cancers we could treat surgically if caught early, but not with non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma, if caught very early, could be treated with just radiation. If it's a certain type of non-Hodgkin's lymphoma, it can be treated with just radiation. But typically, these patients are treated with chemotherapy. If they're advanced, they just get chemotherapy, maybe even a bone marrow transplant, or moderately extensive disease. Those patients are treated with chemotherapy and then radiation afterwards to what we call consolidate things. But it's very treatable. It used to be a death sentence to have non-Hodgkin's lymphoma. But now malignant lymphoma or non-Hodgkin's lymphoma, they're synonymous, is very curable because we were able to identify the best treatment based on the subtype of malignant lymphoma that a patient may have. So in Ben Frazier's case, I don't know the details of it, and some are more aggressive than others, and some are more advanced than others, but it's certainly very treatable and more curable than it ever has been.
Dr. Scott Ackerman, thank you for your time this morning. We appreciate it.
Thank you.
And we'll be right back.